Hi, welcome to my video vlog. This is Dr. Brad Reedy. I'm the clinical director and co-founder of Evoke Therapy Programs. One of the things I've been thinking about lately and teaching about and writing about is the idea of psychology versus therapy. Psychology is the science of human behavior, the study of human behavior, whereas therapy is a healing therapeutic process. And what brought me to this idea, this concept is, as I was observing some of our staff, as I was watching some of our therapists, I noticed the correct application of principles. I noticed that they were able to identify diagnoses, defenses. I also noticed our clients and students being able to do that with themselves and with others. So while there was an adequate grasp of techniques and terms and diagnoses and labels and principles, I don't know that that's always the healing thing. The difference between psychology and therapy is that therapy is a process. Therapy is a healing process. Whether it be physical therapy or psychotherapy, it's something that addresses the wound and helps it move to a place of wholeness and healing. And so sometimes that means that we're quiet. Sometimes that means that we just listen. Sometimes we don't pull down the walls, the defenses that are set up by the individual to protect them from a perceived threat. I think about it this way. If you walked up to somebody and you were able to identify their defenses and you began metaphorically to pull down the bricks of the wall that they had built that protected them against something that they believed was a threat to them, what would be their natural instinct? What would be your natural instinct? I think for most of us, we would recognize that if somebody starts to pull down the walls that keep us feeling safe, we're going to build that wall up quickly after them. And so part of the idea is to honor the wall, to honor the defense, as they talk about in therapy sometimes, to be able to understand that those things are there for a reason. If we merely identify them, we don't always provide a healing process for them. So to understand, to follow them. That's why I talk about this idea of following the symptoms, like a trail of crumbs back home to find the wound. And if you can do that with gentleness, with compassion, with patience, then the client is able to heal. And I think for those of us who are loved ones, for those of us who are treatment providers, I think sometimes we get impatient for various reasons. We want to see somebody get to a place of healing and wholeness. And part of that process is to impose on somebody else something for them that doesn't feel safe. So for us, it requires capacity, right? Psychology does not require great capacity. Any graduate student can tell you that after they learned a few ideas, principles, and theories, they began to practice psychology, if you will, on unsuspecting friends and family members and loved ones. That doesn't take great capacity, but therapy does take great capacity. Therapy takes an ability to hold somebody in their pain, to tolerate what I call empathic misery. And so for parents, for therapists, it's the same process. It's holding somebody, being patient, being clear about your boundaries, right? There's some things I do and don't feel comfortable with. But in essence, in order to heal, I need to help somebody feel safe. I need to help them feel like healing is going to come on their terms. If we think about trauma, one core element of most trauma is the loss of control. So if we come into somebody's lives and we start to identify the defenses, the trauma, we're doing it to them, right? Rather than creating a safe space, a safe process where they're willing to look at it themselves, which is a very frightening enterprise for them. So when I think about this, when I think about the difference between the application of ideas, of theory, of psychological terms, and the difference between therapy, I think about it in terms of capacity. Therapy and providing a holding or a containing environment for somebody, a safe environment for somebody, requires great capacity. Oftentimes lay people don't recognize that. Sometimes therapists don't recognize it. Sometimes when I'm depleted, I don't recognize the difference. In our clients, sometimes we call it weaponizing the skills, right? You learn communication theory and then you beat other people up over it. You're technically right, just like in the application of psychology. You're technically right. But are you healing? Are you contributing to a sense of safety? So the invitation for all of us is to continue to develop our capacity, to be able to be, in a way, be with others in a way where they can feel safe, where they can begin to gently, slowly pull down the bricks, pull down the barriers, pull down the defenses that protect them. They have them for a reason. And whether it's our family members or our clients, The invitation is to develop a greater capacity and an ability to provide that context where somebody can heal. So I hope this is helpful. This is something we're talking about at Evoke with our staff, with our therapists. I think it's something that has fantastic application to all of our relationships, and I hope it's helpful to you. Thank you.